Hi, I'm Paul Chartier. You've tuned in to Heart of Gold. Thanks for watching. These lovely and nice ladies are from Hospice of the Bluegrass. Liz Fowler, President and CEO, and Dr. Kimberly Bell, the Associate Medical Director.
Correct.
Yes, well, thanks for joining us.
You're welcome. Thanks for having us.
People, I think, know the name hospice, but for those of us that may be going through it in the near future, in general terms, for the people that don't know, maybe tell them what hospice is, and we'll get into specifics later on.
Okay. Hospice is for anyone that has a serious illness. And the biggest thing that we hear is people don't know that they can have hospice care sooner in their illness than they do. Most folks think that hospice is just for the last few days of life, but we can really go in sooner, usually in the last 6 months when a doctor thinks a disease can't be cured any longer. And we can help a family for months. And there's a lot of different things we'll do that we'll talk as we go on today.
The respect and comfort that you can offer families, because we're not medical people. You know, we don't know what to do. We don't want to give shots. We don't want to give medicine. We don't want to walk down a path. You've been down this path.
Right. And so I think one of the things that's large for us is the fact so many people say, well, we want to pass away at home. You know, but statistically, there's more and more deaths in hospitals or in agencies. And so one of the things that hospice does, great job, is that they allow teaching for families to be able to care for their loved ones. So the way I sort of explain it to families is that you guys are going to still continue to provide that compassion and that care, but what we do is we provide the tools. We provide, you know, if there's medicines needed, if there's equipment needed, if there's nursing specialties, social work, chaplain, whatever that specialty is, you know, it allows them to be able to, that last few, whatever it is, days, months, whatever it is, that they can have dignity, they can have peace, focus on symptoms.
For people that don't know, they may think hospice, oh my gosh, it's another check I'm going to write. Liz, how does that work?
Well, most insurances pay for hospice, and Medicare and Medicaid pay for hospice. And being a not-for-profit community-based organization, we take care of anyone regardless of their ability to pay. And yes, many people do think that hospice is too expensive to have someone come to their home, but it is a great benefit that most commercial insurance companies cover, as well as Medicare and Medicaid. So people shouldn't worry about that. They should give us a call, and if they need help, we want to provide it, being a not-for-profit community-based organization.
And from day one, if someone knows that a loved one is going to be on that path, you can go in early and provide counseling. Before the person's actually in a assisted living, you can go into the home and talk to the family, explain the entire process.
So typically our referral process starts, and it can start with anybody. You know, a lot of people say, well, it has to be referred by a physician. No, that's not the case. They can be referred by a friend, clergy, a neighbor, family. They can refer themselves. They can be referred by a physician. It actually takes 2 physicians to say that they anticipate with normal disease progression that they have less than 6 months to live. And so if anybody has a question, we're happy to send a nurse out to do an assessment, to do an evaluation, and then we can sort of determine, you know, okay, we might think this is a little bit early, we might check back a month or 2, or in most cases, like Liz says, I think the biggest complaint is that people say, I didn't call hospice soon enough. So.
And speaking of hospice, if you'd like to share your phone number and your website that people can contact you.
Yes, our website is www.hospicebg.org, and our phone number is 800-876-6005.
Even if they're located in Lexington, Central Kentucky, they would call that phone number and they would get to your team.
Correct. In fact, we would help anyone find hospice in any state their loved one might live in, because we know you might live here in Kentucky and have family in other parts of the state or other states, and we would help connect someone with their local hospice. But feel free to use our 800 number.
So they can receive hospice care at home. Insurance covers some of it. You've got doctors on the staff. Who else is part of that team that would go in and talk to a family?
You know, that is one of the great things about hospice care, because not only do we have medical staff that are certified in hospice and palliative medicine, that it's really a specialty, but we have nurses who are also certified in hospice and palliative medicine, social workers who provide counseling and connection with other community resources. We have bereavement counselors that begin to help counsel families, because we know that's a big struggle, and we actually follow families for 13 months after a patient passes. We have aides who come in with and help with bathing and personal care needs a family might have for the patient. Homemaking support we provide, and we have chaplains that provide spiritual counseling and spiritual care. So it's really a group that takes care of a patient and the family and determines what does that patient and family need, and what's going to be most helpful to have them have a meaningful experience, to spend time together, be comfortable, have good memories. Dr. Bell, you can probably add to that the great things our teams do.
One other person that I'm going to add, and just sort of a plea, I guess, almost, is our volunteer staff.
Right.
And so,
Yes.
you know, I can't say enough about our volunteers. Everything. They can do office work, they do transportation. Sometimes if patients need to go to appointments, they may take them to the grocery store. I mean, if there's a need, I have a volunteer that can fill it. So certainly if you need extra things to do, we're always happy to have volunteers.
We'll give the phone number in a minute. How big is your staff, and how many volunteers do you have through a 12-month period?
We have over 450 full-time staff. We have about 200 part-time staff, and we have about 700 volunteers.
Oh my gosh.
So we have a large group
Yes.
of folks to pull from.
That's a big Christmas party.
Yeah, to take care of our community.
That is a phenomenal number of people to juggle. I know you've got a beautiful office off of Harrodsburg Road in Alexandria,
Correct.
and you've got a place in Hazard.
Correct.
Do you have other places? Because that's a lot of employees to work out of 2 locations.
We do. We have offices in Cynthiana. We have offices in Frankfort. We have an office in Northern Kentucky, and we have an office in Barberville. But our staff don't need offices anymore. They work virtually. We do a lot of teleconferencing. Everyone's set up with laptops and cell phones. They do their work in patients' homes and in the hospitals and nursing homes and the assisted living facilities in our community. So yeah, it's not about the offices anymore. It's their car and they go.
You're the only ones I've ever heard do virtual office. Nobody else does that. Dr. Bell, you talked about volunteers. How do you train the volunteers? And I guess you do background checks. Do they need a medical degree to be volunteers?
Oh, definitely no.
Okay.
So yes, we do background checks, and they do have to go through specific training. And depending on what type of, all of them go through basic volunteer training that has to do with patient confidentiality and sort of what is hospice and things like that. One of our special volunteers is the 11th hour volunteer, and what those particular volunteers do is they come into nursing homes, hospitals, patient homes, assisted living, for when we think that their time of death is near. And so they have that special training, special sensitivity to sort of deal with patients, deal with families, maybe where they don't want them to be alone, but maybe family can't be there, or perhaps they don't have any family.
I really can't stress enough that you are the angels that come in when it's toughest for the family and the patient, the mom, the dad, whatever the case may be, the child. This is not an easy time, but with your kindness and compassion, I mean, you are just fabulous at what you do.
You'll find, Paul, that most of our staff, between the training we give them and the meaningfulness of this work, they stay with us a long time. We have a lot of staff that have worked for us 15 years, 18 years, 20 years, or they relocate and they come from another hospice. And it really is the superb teaching skills that they have and the excellent communication skills to help them learn what patients and families need most and what's most meaningful that really makes a hospice professional very different than oftentimes you see that other in-home or acute care.
That I've seen great medical people. They've got their chart, they've got 5 other people waiting. They swoop in, they do their thing, and they leave, go do the next one. Hospice, I mean, they are really forming a relationship. They're not there just to make the office visit, make the home visit, and leave. I mean, they are there to really make sure that everybody is doing as well as they can possibly do.
And I think that's, you know, with our multidisciplinary team, I think that's certainly an asset, because whatever, if it's emotional, spiritual, financial, medical, you know, that's why there's multiple disciplines there in the home, and certainly, or whatever their care setting is. You know, and certainly I think part of the benefit for them to do that is again, like Liz says, is it also affects families, you know, from that standpoint.
It is fabulous what you do. In the last 3 minutes, what are the barriers, other than a staff of 700 volunteers, what are the barriers? Is it getting the word out to people that you are available and maybe free or insurance covers it?
I would say the biggest barrier, you know, again, is people say that we haven't been referred soon enough. You know, I didn't call hospice soon enough. And I think that comes from several aspects. I think families don't want to say, you know, I'm calling hospice, because they think, well, that means they just have, you know, days or weeks to live, and that's not the case. Typically, that means you have less than 6 months to live. So studies have shown if we can be involved in a home at least 4 months, that the grief after that death and the process through that death tends to be much easier for families and much easier for patients. So I think that's the biggest one, is that we're not called soon enough. I think also, and I would just say this as a physician, is that I think we continue, even though there may not be long-term benefit, to continue to treat. You know, we can, just because as a procedure that we can do doesn't always mean that we should do that. And so I think patients, physicians, community, all of that is hesitant to say, this is something we can't cure. It's not part of physicians' training to say, you know, this isn't going to get better. Because our nature as physicians, nurses, providers is really just that we can do this to make it better. And at some point, and we continue to make things better because we treat symptoms, but I can't cure your disease.
You know the outcome, you're going to make it as comfortable and pleasant as possible. Liz Fowler, in the last minute, you've been in Lexington how long?
1.5 years now.
And good for you for adapting to Kentucky Blues so quickly. That's awesome.
Thank you.
In the last minute, if you'd like to give the phone number, website again that people can call.
Sure. Our website is www.hospicebg.org, www.hospicebg.org, and our phone number is 800-876-6005.
Thanks again, ladies, again, for what you do. We know the outcome, but you make it as good of a possibility and environment that you can, so thank you very much.
Yeah.
You
Thanks
all
for having
wear
us.
angels, wings, halos, I'm not sure, but the wings for sure. Thanks for
Thank
coming
you.
in.
Thanks for having us.
I'm Paul Chartier. We'll be right back on Heart of Gold.